All right, wait for everyone to be ready. All right, good morning Queensland, and in some excellent news today, it's a double donut day, so 0 cases, which is fantastic. So well done Queensland, keep that up. So we have 18 active cases. We now have, yesterday we had 12,649 tests, so that's good news. So what we are seeing is that people are getting tested, so that's great. If you have any symptoms, please remember to do that. Yesterday we had 18,092 vaccines by Queensland Health. We now have, of eligible Queenslanders, 53.33% have had at least one dose, and 34.75% of eligible Queenslanders are fully vaccinated. And you might remember yesterday we were talking about the walk-ins at Logan. Can I say excellent news there? We had 934 walk-ins, which is fantastic. And last night I convened a meeting with, along with Dr Young and the Deputy Commissioner. We had a meeting with a whole range of multicultural community leaders, and their clear message to us is that they want to absolutely engage with their communities to get vaccinated, which is fantastic. And you can see the results of that, where we're getting people in Logan coming in, families from a whole range of different multicultural communities, and getting vaccinated. So thank you, thank you, thank you. And we're going to see a lot more of that over the coming days and weeks. So our vaccination program is ramping up, and today we're at the Brisbane Entertainment Centre, or other people call it Boondall. And I really want to thank everybody for getting this up so quickly. This afternoon we'll be having about, my understanding, about 200 police will be coming through to get vaccinated. Mary just advised me some of the boarders from St Peter's are coming in to get vaccinated, and then they're booked out for the next couple of days. So if you are living on the north side of Brisbane, this is a great opportunity for you to come here and get vaccinated. So log on to the Queensland Health website. We will be able to do 1,500 vaccinations per day here. It'll ramp up to 3,000 vaccinations per day next week, and we can scale up to do 6,000 doses a day. There is ample parking here. It's all set up. It's a wonderful venue, just like we have at the Convention Centre in Brisbane, which is going extremely well. So if you're on the north side of Brisbane, this is the place for you to come. So we will be seeing more pop-up clinics. We've got community outreach happening, and we also had a mobile clinic van that started up yesterday in Yarrabilba, which is great. So we're actually trialling different things across the board. Now, I want to just mention to Queenslanders that Queensland Health currently has about 80 vaccination centres open across the state. Now, over the next 2 months, of course, we mentioned that we've got a new mass vaccination centre starting up in Cairns. We're going to have mobile pop-up clinics. We're going to have that mobile van that started in Yarrabilba, an advertising campaign encouraging Queenslanders to get vaccinated. And of course, we're going to be sending out text messages to Queenslanders. Now, we do that during when we're in natural disasters. We have that capability to do that through our Disaster Management Committee. We're going to be sending out text messages to people to be able to tell you where your closest vaccination centre is, whether it's a vaccination centre, a pharmacy or a GP. So this is added information to get Queenslanders vaccinated. Now, can I say, you know, we are very concerned about what's happening in New South Wales and Victoria, and now Queensland is your window of opportunity to get vaccinated. It is absolutely important. I know a lot of people are having conversations in their workplaces, at home, in shopping centres. It is absolutely important. Now is the time to get vaccinated. We also have Trent here from the Pharmacy Guild. He'll be talking to you about how you can go to your local pharmacy and get vaccinated. We also know that the AMA is very supportive of the vaccination program. So my message today is don't delay, get vaccinated. There are a lot of places for you to go across Queensland. Don't hesitate, because we are seeing what's happening in New South Wales. Massive cases, numbers are increasing. ICU and hospitals are being stretched. We want to make sure that we have this window of opportunity to get as many Queenslanders vaccinated as possible before the Delta virus gets here. I think everyone knows that it is going to be impossible to keep this out forever. We need to do everything we can to prepare our population to get vaccinated. So I can't stress to you this is so urgent. It is almost. It's almost a plea to Queenslanders. Please come forward and get vaccinated. Tell your friends we're engaging as many communities as we possibly can, and of course, where those areas have some lower vaccination rates than the rest of the state, we are doing targeted vaccination programs for them as well. So I'll hand over to Dr. Young. Thanks.
So, good morning. So, excellent news. No cases in the community nor in hotel quarantine. So, 0 cases, which is fantastic. And I thank all those families that so quickly went into quarantine over the weekend. And I'm glad that all those kids can go back to school at Windaroo State School, because all of the children who went to the after-school care part of the childcare centre have now tested negative, so that is excellent. But they will still need to remain in quarantine, the children that attended that childcare centre, for the next 14 days. So thank you very much to them. And thank you also to those 2 additional people who attended the nail salon, who came forward yesterday to let us know they'd been there, and we've tested them. So thank you very much to those. There's still 1 or 2 other people, I believe, who did attend. Please, if they could come forward so we could check with them. All that is excellent. So now what we really must do is, as the Premier has said, this is our window to get vaccinated before the Delta variant spreads through our community. We've had a few issues over the last few months, of course, and we've been able to, due to the great work of Queenslanders, manage those risks. But eventually we are going to see cases spread that we won't be able to manage unless we're vaccinated. So now is the time. Just go out to places like this, to places all through the state of Queensland, to your GP, to a pharmacy, and get vaccinated. That's absolutely critical. Thank you.
Well, look, as you can see, we are absolutely racing to get as many Queenslanders vaccinated as we possibly can. We have this window of opportunity in which to get people vaccinated, and we are desperately holding that window open. That's what our border restrictions and other restrictions are doing. We're holding the window open for as long as we possibly can to get as many Queenslanders vaccinated as we possibly can before the Delta strain arrives here in Queensland. And what we've said is that we would be able to get more people vaccinated in that window if we had more vaccines. The federal government's own reports state that Queensland is one of the few states to be fully utilising our vaccine allocation, and we're just learning now how many of the states, how many vaccines that were destined for Queenslanders have been redirected to New South Wales. Now, we've supported that because we understand the situation in New South Wales is very different, but it's important that the Commonwealth is honest and upfront about how many vaccines they are taking from Queenslanders to give to New South Wales. It's also incredible to see the nerve of Greg Hunt to be out there criticising Queenslanders, calling us laggards, when he knows full well how many vaccines he's taking from Queensland to give to New South Wales, and he knows full well that we are fully utilising our allocation. If we had those vaccines, then we would be higher up the league table that he and the Prime Minister and others point to, but more importantly, more Queenslanders would be protected. Those redirected vaccines are coming from the Commonwealth's share of the task of vaccinating Queenslanders. So you'll have heard the Premier say before that the Commonwealth committed to do 70% of the rollout and the state committed to do 30%. Well, now we are doing roughly 40% of the rollout and the Commonwealth is doing closer to 60%. That's because of those reallocated vaccines and because Queensland Health is stepping up to do more than we committed to at the beginning of the rollout. To be quite frank, I'm less concerned about where the Prime Minister spends his weekends and more concerned with where he's sending the vaccines. I'm also concerned that we continue to have one of the lowest rates of aged care workers who are fully vaccinated, and concerned to see that the Commonwealth's own Horizon reports suggest we'll continue to get less than our fair share of the vaccines through September and through to the end of the year. These reallocations can't all be explained by the outbreak. If it was just because of the outbreak, then why would they be taking vaccines off Victoria as well to send to New South Wales? All we're asking for here is some honesty, to stop criticising Queensland and Queenslanders for our vaccination rate, which is largely caused by the flow of vaccines into the state.
Well, the Commonwealth spent months saying to every Queenslander that all of the vaccine that Queensland has on stock can be used, that we didn't need to hold on to any for second doses. And they changed the rules in June, overnight, said they're not providing us with additional stock for second doses. We had to use our existing deliveries. That meant from June on, we are now only having half of the vaccine available for first doses. So the Commonwealth does need to be honest. They stand up beating their chest every day saying that they're proud of the vaccination numbers across the country at the same time as criticising Queensland. But their own report online today, dated the 6th of September, actually shows that Queensland is fully utilising their stock. Estimated dose utilisation next to Queensland, fully utilised. There are only 3 jurisdictions on that page that says fully utilised. So if Scott Morrison wants to give us the vaccine, we will use it. But 100,000 of the extra doses coming from Singapore, only 40% is coming to the state to put into mass vaccination centres. 60% is going to GPs. Now, we welcome our GPs vaccinating the community, just like we welcome our community pharmacies, because we can't do this alone. But the Commonwealth Government and Greg Hunt, Scott Morrison, have got to stop playing politics and be honest about the distribution of the vaccines, how much is being given to us and when it's being given to us, because we are using everything that we have got. Now, the risk is greater than we've ever seen before. Last year, we were saying the biggest risk to Australia and to Queensland was our international arrivals. We had to stop the virus at our international borders. But as at today, we are seeing more infections and positive cases every single day out of New South Wales than we're seeing across the whole country as far as overseas arrivals. So our risk is closer than it's ever been before. It is right on our border. And I suspect today, unless we see record low numbers of positive cases out of New South Wales, they will tip over 30,000 cases today. Yesterday, there were over 29,200 cases. So they'll hit 30,000 positive cases in less than 3 months, 137 deaths. That now means New South Wales is averaging more than 40 people dying a month from this one cluster. That's why we are calling on every Queenslander to come and get vaccinated, whether it's with a state clinic and our wonderful vaccination clinics like here at the Brisbane Entertainment Centre or the Boondall Convention Exhibition Centre or Logan Entertainment Centre, or all of our 80 community hubs that we have operating, or go to your GP who has AstraZeneca and Pfizer, or go to your community pharmacy. And I know our community pharmacies will be expanding to also have Moderna very soon. So the options are there. The vaccine will increase, but we don't have enough to vaccinate every Queenslander right now. But we do have vaccines and bookings available, so please come forward, get vaccinated. And our message to the Morrison government is pretty clear. If you say we're all in this together, then mean it. It's not just words, it's action. Stop picking fights and stop criticising the 2 states that have been the most successful in managing this virus, and help us get our community vaccinated.
Thank you, Premier. Well, we've all heard of AstraZeneca and we've all heard of Pfizer, but today I'm here to introduce you to our new weapon in fighting COVID-19, which is Moderna. So the Moderna vaccine will be available in community pharmacies from next week. 1,200 community pharmacies will receive stock at the end of next week, and 1,200 will come on board each week until we hit the 4,000 mark in just under 3 weeks' time. So the Moderna vaccine belongs to the same family of drugs as the Pfizer vaccine. It has a very similar safety profile, a very similar efficacy profile, and it is approved by the Therapeutic Goods Administration for administrations to all Australians 12 years of age and over. So this is the vaccine we've all been waiting for. 1 million will be arriving on Australian shores this month. 3 million will be arriving on Australian shores each month for the next 3 months. And we will have over 10 million Moderna vaccines available in Australia before the end of the calendar year. So Australians, so Queenslanders, how do you get Moderna? Well, it's very simple. You ask your pharmacist. You ask your pharmacist to help you with your other medications, and you can continue to ask your pharmacist to be able to assist you to protect you and your family against the Delta strain. Because as the Minister said, it is only a matter of time before Delta arrives in Queensland. It is only a matter of time before Delta arrives in every community in Australia. It is incumbent upon each and every one of us not only to roll our sleeves up and do the right things to protect ourselves, but to do the right thing to protect those in our community, like our young children, that cannot receive a vaccination. Now, I've got family in Tasmania, and I really want to spend Christmas with my family. And the only way I can do that, the only way all of us can do that, is if we go to findaPharmacy.com.au, or you use whatever mechanism it is that you access your local community pharmacy. Walk, ride, take your car, pop in after work or before work. Australia's 6,000 community pharmacies are open earlier, later and longer than any other piece of Australia's primary healthcare system. So we're here for you. We're not just here for you to help you with your regular medications. We're now here for you to help you with the rollout of Australia's latest vaccine, the Moderna COVID-19 vaccination from next week. Thank you, Premier.
Just quickly, the 1,200 community pharmacies, how do people find where they are?
So you go to findaPharmacy.com.au. From next week, you will start to see those pharmacies that are available in Tranche 1 appear on that site. So at the moment, it is the 3,000, 3,500 AstraZeneca access points that are on that site. And each week, as 1,200 pharmacies are added, you'll be able to see which ones. You can search by vaccine. So we're still encouraging those people who are over the age of 60 to do the right thing and avail themselves of the AstraZeneca vaccine. You will have choice. You can choose Pfizer, you can choose Moderna, or you can choose AstraZeneca. But we are preferencing those parts of our community that currently have no choice and can't receive the AstraZeneca vaccine first. So that's our adolescents, that's our children. We've been working with the Minister's office on making sure that community pharmacies, in fact in northern Queensland, in communities like Yarrabah, in some of the aged care facilities that have below national and below state averages, pharmacies won't just be providing the Moderna vaccine within the 4 walls. We'll be going out and running high school programs. We'll be going out and running vaccination programs in Aboriginal communities and, of course, in aged care facilities.
And is that 1,200 in Queensland or across the country?
It's Australia-wide. So the 3,600 pharmacies out of the 6,000 that have been approved so far for administering Moderna vaccine, and of course we encourage all of Australian pharmacies to register their interest, they will be rolled out in 3 stages. We've only got 1 million Moderna arriving this month. We've got 3 million arriving next month, so we can't give it to everybody at once. But it's a 3-week rollout, which means there's only 14 days difference between when the first pharmacy receives their shipment and the last pharmacy receives theirs. So it's quite a quick rollout, really. Thank you.
Yesterday we saw 6,003 vehicles cross our road borders, of which 95 were turned around and 1 placed into quarantine and 2 on-the-spot fines. I'm very pleased to say that we are seeing Queenslanders and relocating people coming to Queensland coming in as of yesterday, and whilst the numbers are relatively low, only 60 placed into domestic quarantine yesterday. That will increase significantly over the coming days, and the system is working. But a reminder to all those coming, there was 1 person turned around who didn't understand the requirements that you must have the exemption and then also the border pass. You won't get through with the appropriate approvals. We handed out 37 masks yesterday. I just want to remind people that masks still remain a requirement in certain settings. You must carry them and wear them when you should. So that brings to over 6,000 masks that police have handed out in this operation, which is a lot of people not wearing masks. So please pay attention to that. I also want to mention that 44 businesses were checked yesterday for compliance. Now that includes QR code compliance. So we are checking our businesses to make sure that they are appropriately displaying and then making, where they can, making sure that people are complying with the entering the QR code. But the onus is upon the individual. The onus is upon the individual. There's over 5 million people in this state. You really need to enter the QR code when you're going into these places. The reason is for contact tracing. As you've seen with the recent events on the south side of Brisbane and Logan, that contact tracing is absolutely crucial to us being able to get on top of this, which we've done very effectively. But in this instance, we've had to do a lot of chasing in our contact tracers to try and track people down because they weren't putting it in. There are fines. So if it is an incorporated business, it's a $6,892 fine for not doing the right thing with QR codes. For all other persons, including small businesses not incorporated, and individuals who don't do it, it's a $1,378 fine that can be issued. So please, please work with us on that. This is really one where we just want to educate and make sure people do the right thing. I should also just finally mention the vaccination rollout. It's very impressive what's being done. Can I acknowledge the work that's been done by all parts of government to deliver this? Our part of that is making sure that you've got a system that you can access readily and get vaccination. What we need from our community is to buy into that. So please work with us. We are about keeping our community safe. Thank you.
Sorry, how many people have applied in that new application process since Sunday?
I don't have the exact figures for you. As of yesterday, it was around 250. So we'll get an update later if you want.
And how long can people wait? Sorry, some people have obviously put in their application yet to hear back. What's the time frame?
Look, that's also something. It's a new system. At the moment, we're working a manual system. We're developing an ICT solution that we hope to have up and running within the next month or two. That will streamline things. But at this stage, early days yet, because we're dealing with people. We'll see how that pans out and can advise later too.
Just on the QR codes,
sure.
Is it up to police to issue the fine, say, if there's no compliance with
QR Look, people should also remember it's not just about police this system. We have liquor regulators that check as well. There are all parts of government, including local governments, that will look for compliance around this. We will investigate where we need to, but we tend not to take action in relation to this unless we find people actually doing the wrong thing, because obviously that's protected data. It's for health use, that data, so that people need to have confidence that if they put their details in there, our police officers are not going to access that simply because they didn't do the right thing. What we want them to do is put the information in there so we can contact trace them if we need to.
Is there anything else being done though to ensure, like, to check compliance, given what we've seen like a week ago in Beenleigh, like to be able to monitor?
Yeah, look, we do high visibility patrols not only into external areas where we see people gathering, as we saw on the weekend, but also into shopping centres and other high volume areas, particularly where people might need to do that. I went into a shopping centre last night in uniform. It was very surprising how many people put their masks on and started doing their QR codes. So we are out there. We will continue to do that. That's the kind of thing we want people to make it an automatic thing. Thank you.
Yes. Are they the sorts of measures though that should have already been started? We're months into this rollout. Shouldn't they already be advertising campaigns about the vaccine?
Well, through National Cabinet, the federal government was committed to running a vaccination program. That was discussed at National Cabinet. So now we're actually targeting our campaign for different communities, but also too for those people who might be a little bit unsure about whether or not they want to get the vaccine. We really need everybody to urge their friends and family to get this vaccine before the Delta virus arrives in this state.
And where will the pop-up clinics be?
We're working those out, but we're targeting the pop-up clinics in the areas where they have low vaccination rates.
Are you concerned about Logan's vaccination rate?
Well, I'm encouraged, Tim, by what we saw yesterday and Sunday. Like those walk-ins, obviously, that's what's working well in some communities. So we're going to look at where we can expand walk-ins for people. Some people, whether it's problems with literacy or communication, can't navigate the portals for logging in. So we need to make it really easy and accessible for all Queenslanders, no matter where they live. And like I said, some of the areas with the highest vaccination rates are some of our rural and regional communities where the whole town has come out and taken up the vaccine. But we've got a lot of people living in Queensland, and we need to make sure that everyone who is eligible to get the vaccine gets the vaccine.
Premier, do we know when?
Sorry?
How many of those vaccines that were destined for Queensland have been redirected to New South Wales? And are you disappointed by what you're hearing out of Canberra?
Look, what I'd just like to say here is I believe this needs to be a partnership. Okay, it needs to be a partnership with the state working with the Commonwealth. I've always said this, it works best when we work together. But please, don't pick a fight when another state is getting more vaccines. And we understand that the other state is going through a really tough time. I mean, the people in New South Wales and the families, we've all got friends and families down there as well. We know how tough it is. I spoke in Victoria. I spoke to a friend in Victoria last night. I understand how tough it is to be at stay-at-home orders and not being able to see your mother or your friends. It's having a huge emotional toll on people. So yes, we understand that when a state is going through a particular troublesome time, that yes, more vaccines should be allocated. But don't go then and blame Queensland and Western Australia for getting out the vaccine that we have available. So my message is, let's work together and let's get this done.
What about other jurisdictions that have quite a high vaccine rate that haven't had outbreaks, like Tasmania? They're way ahead of Queensland.
Well, smaller populations.
Premier, do we have any indication yet on when Queensland will hit the 80% vaccination rate?
I don't at the moment. We're doing those projection and forecasts at the moment with the supply. So once we get the allocations of supply forecast over the next 6 to 8 weeks, and we get updates at National Cabinet as well, we'll be able to say more. But our clear message today to Queenslanders is to come and get vaccinated.
We just had someone who wants to go to Tasmania. Once we hit that mark,
yeah,
it'll be people from Queensland will be able to go into state once we hit that 80% mark.
I hope so. I really hope that Queenslanders will be able to travel, but we just need to see it's when the whole of the country gets to that stage. But we already do have states that are open to travel. So. I think you'll see that people will look to those states where they can travel and make those travel plans.
Will hit it by Christmas?
I hope so. It all depends on the supply. If we get the supply, we can get into people's arms. And the other thing we need to do is we need to have a great coordinated state and federal campaign in getting the clear message out to get vaccinated. That's why I'm asking people to send me their selfies and their images of getting vaccinated, and people are sending me videos before they go and get vaccinated and what it's like after they've been vaccinated and giving me the thumbs up, and that's what I want to see. I want to see Queenslanders as a community coming together to protect not just themselves, not just their loved ones, not just their friends, but their community. And then it just means then it's safer for everyone to go out and enjoy our Queensland lifestyle, which we have become accustomed to.
The New South Wales, a lot of young children particularly stuck interstate.
We're working through all of that. Yep, absolutely. We're working through all of that. So they should, if the parents can contact the exemptions unit, we will be working through that as a matter of priority.
There's an 8-year-old who says, a mother here in the Gold Coast who says her 8-year-old son's been stuck for 10 weeks. She's been denied an exemption for him to go and isolate at home. Does that concern you? You're still hearing cases like that?
Look, that shouldn't be happening, Tim. We're happy to follow that up. Yeah.
Just on the assisted dying laws next week,
yes.
Can you explain why your government decided not to introduce that blanket institutional right to conscientiously object like the South Australian government did?
What I can say is that Cabinet is still considering that bill, so that will be coming to Cabinet next Monday, and I'm not going to preempt Cabinet's discussion, and then there will be the debate next week during the Parliament. And once again, I'm asking for it to be a respectful debate. I think we've had a respectful debate in the community about voluntary assisted dying, and I'm asking the Parliament to also have a respectful debate.
What do you say to churches who say they felt let down by you, given previously you had given assurances that they would have this right to?
Oh no, what I can say is I'm actually engaging with the churches, so that's actually not correct, Lydia.
So when you say that Cabinet still has to consider the bill, even though the committee's recommended, are you saying that you could still make changes to it before it becomes?
Well, what I'm saying is that before it goes into Parliament, the bill comes back into Cabinet as the authority to introduce into the Parliament, to debate it in the Parliament.
And you still have changes made to it?
Well, Cabinet can do whatever it wants to do. That's the prerogative of the Cabinet, and I'm not going to preempt the Cabinet.
The New South Wales government says some areas in New South Wales that have low COVID numbers could have lockdown restrictions lifted, which would mean more than New South Wales. If that happens on the weekend, how would our border be impacted? Would you lift restrictions on the border? Once
again, we want to engage with the New South Wales government, especially around our border communities. In some of those border communities, there are no cases. We would have to make sure we get the sewage tested and all of that. I mean, Dr. Young would have to advise us on that. But that's a matter for them. And if they make that decision, of course, we'll look at it very quickly.
Premier, how do you think about obviously taking the vaccine disputes out of it? The Prime Minister flew from Canberra to Sydney and back to Father's Day at a time when house visits are banned in New South Wales and the ACT. What do you think about that?
I'm not going to comment on that. That's a matter for him. That's a matter for him to explain. Well, that's a matter for him.
Premier, how do you feel about integrating proof of vaccine into the Check in Queensland Act?
Yes, so I can say that National Cabinet is having discussions about the incorporation of that. We are working with the Commonwealth about how that would work in terms of protecting the privacy, and that is something that I would like to see. So yes, we are in detailed discussions about that.
And last week, I think Dr. Young mentioned that once you saw the updated Doherty modelling, there might be some additional measures that you'd be looking at once we hit 80% vaccination.
There's more modelling being done. It hasn't come back into National Cabinet, so I'm not going to preempt any further discussions until we see that modelling. And I think that's the right thing to do. I think the modelling needs to happen, needs to come into National Cabinet for a very full conversation, and we look forward to seeing that advanced modelling.
Premier, the rhetoric seems to have changed in the last few days. Now it seems that all of you are saying that Delta's going to come here and border closures and lockdowns won't be enough to stop it. Is that correct?
Lydia, I think what we're seeing across the world is we are witnessing a global pandemic. I saw that with my eyes firsthand when I travelled over to Tokyo and saw that they were in a state of emergency, when I saw and spoke to people about what was happening in other countries, where in the US, in some parts of the US, children hadn't gone back to school for 18 months. I witnessed going through international airports like Singapore were like ghost towns. There was no one travelling. Yep. So now what I'm coming to is that what we are seeing in Australia is we are seeing a very large outbreak of the Delta virus in New South Wales, a highly contagious Delta virus, which is causing people to become very sick, and it's also causing people to end up in hospitals. What the Health Minister said, and what I agree with, is that there has never been a more real threat to Queensland than what is on our border, and that is the encroachment of Delta. That is why hotel quarantine is still needed to make sure that we are not importing the virus into Queensland, but that is why we are also trialling home quarantine for those families that can home quarantine with their children, especially those unaccompanied minors. So we are trying everything we can to keep us safe, but we are seeing with the freight drivers is a real risk that we've had a couple of cases in just recently where the Delta has popped up. So I've got a team of people working on that, and also being raised at the federal level as well, because the freight drivers are travelling right around the country. So we have real concerns. The best thing we can do to protect ourselves and our community is to get vaccinated. And that is my very clear message to Queenslanders.
So the bottom line is the virus is coming, and really the only thing that's going to protect people is getting vaccinated.
I think everybody in Australia would agree with that. So we need to get vaccinated to protect ourselves, protect our families and protect our community from what would happen if the Delta virus takes hold in Queensland. And we have real concerns about what is happening in New South Wales as it is spreading across New South Wales, and we are seeing high rates of infections and massive spread of the virus. So it is a real and present danger, and the way we need to defend ourselves is to get vaccinated.
Okay. We are still seeing lots of people though hugging and kissing on that border at the Gold Coast.
Well, that's putting people at risk. Yeah. It is putting people at risk, and can I say this? Queenslanders are free to go around. Okay, that's because we have 0 cases, right, and we don't have those restrictions. But New South Wales has the stay-at-home orders, so that is up for the New South Wales government to enforce those stay-at-home orders. Okay, on the New South Wales border. And we look forward to a time when those border communities can actually come back together. So until that time, New South Wales has stay-at-home orders, but Queensland doesn't. Okay, thanks everyone.
Deputy Premier, you about Ms Morrison's